I'm Dr. Lynn Kowalski. I'm a gynecologic oncologist here in Las Vegas, Nevada. Most patients who come to my office have usually been told by their doctor that they either have cancer or their doctor is concerned they have cancer, and that's why they're being referred to me to begin with. So I think they do come in with that in mind. Most women understand, gee, if there's a cancer, concerned about cancer, I know I'm probably going to need to have a hysterectomy. A lot of them don't even think about the fact that they could have it done with minimally invasive approach. I think a lot of them come in thinking, oh, it's just going to be, you know, what my mother or my friend or my sister had. We're going to come all the way back here. Okay. How have you been feeling?
Well, I feel good.
Yeah, good.
I had understood that it involved big pain. I mean, big abdominal pain, trouble standing up straight.
Yeah, having the Da Vinci surgical system available to me in my practice allows me to offer minimally invasive surgery to more patients, a higher percentage of patients than I was able to before.
It just seems like it's such a big surgery, and what surprised me was how easy it was. It was so much easier of a recovery than having a C-section.
I was having major surgery before I could believe it, you know. And she had explained to me the difference between conventional and the Da Vinci method of surgery. And I thought it over and decided I'd have to be an idiot to go with the conventional surgery, you know. And it was a great choice because very, very quickly I was on my feet.
I've performed over 70 procedures. I've performed them for a variety of conditions, benign gynecologic conditions, precancerous conditions, cervical cancers, and endometrial cancers. Okay.
So when I came home, I was really comfortable. I was walking. It was really amazing. It's major surgery, done with teeny weeny little instruments.
The first thing that occurred to me was that I didn't hurt when I woke up. I had no real pain.
Oh, there's no comparison compared to open. You know, typical patient has an open radical hysterectomy. She's in the hospital for 4 or 5 days, goes home on narcotics, generally takes those narcotics regularly. When she comes back to see me a week or so later, she's often asking for a refill. She needs more narcotics because she's still having a lot of pain. Her activities are very limited, and I find that most of those patients really weren't ready to go back to work until about 6 weeks or sometimes even 8 weeks after the surgery. So with the robotic radical hysterectomy, most of them have gone home in 1 day. If not 1 day, it's been 2 days. Most of them have told me they take narcotics for maybe a day or two. Many of them were driving in a week. I mean, it's like night and day. There's no comparison.
I'm doing pretty good.
Yeah?
Yeah.
Back to work full time and everything's going well?
Oh, yeah.
Beauty salon is busy?
Beautifully busy.
Okay, good. How long was it before you went back
On
home?
Thursday.
So within 1 week?
Yeah.
Wow.
I know. Lynn Kowalski came the next morning just to see how I was doing. I was sitting in a chair, and she goes, "Did I do surgery on you yesterday?" And I said, "Yeah." And I said, "I want to go home." She goes, "Not yet."
So the gap between open radical hysterectomy and robotic radical hysterectomy is the greatest difference that I've seen so far. Even, you know, compared to LAVH versus robotic, there's definitely improvement, but this is a really, really dramatic improvement.
Particularly because I'd had friends that had the traditional surgery, and I knew how long it took, so that if this even lived up to a part of what it promised, and it did, it not only lived up to a part of what it promised, but more from my point of view.
I had surgery on Friday, went home Saturday. I went and seen the girls Tuesday at work, and they all looked at me, "What are you doing here?" You know, because a lot of them had hysterectomies, and they were still in bed after 10 days. So I said, "Well, I feel good."
If a physician says to me, you know, I can just do that operation open, I can do it faster and easier than with the robot, why should I bother learning robotic surgery? I say, well, it's true, you can do it faster, but then you have to think about the time that you spend making rounds on that patient and seeing that patient back in your office for postoperative visits, the potential for problems with wound healing and the other complications that occur. And I think if you add all of that up over the entire course of caring for that patient, it probably ends up being about the same. And then, of course, you add on to that the benefit to the patient of how they feel after the surgery, their satisfaction with the surgery, and their time off work and their time back to their normal activities. I think it's well worth it.
I think every woman who ends up with a hysterectomy has a different reason that she got there. So I'm sure that some of their reasons for beforehand might have affected how they recovered. But no one's story was as nice as mine.
I would not even consider going the old method. I like that robotic.
They'd call in and check on me and say, "What are you doing?" And say, "Well, I'm getting ready to go out to dinner." And say, "You have to be kidding." I said, "No, I'm not kidding. We have the magic touch out here. It's fresh air, sunshine, and smart people." I mean, really.